Right, for this part we're going to have a look at radiation, and we're going to look at X-rays and gamma rays, but I'm also going to bring in a little bit about ultrasound again, because you are asked sometimes to compare X-rays and ultrasound and talk about the advantages and disadvantages. Okay, so we've already looked at radiation, and we've looked at how the nucleus is unstable and they emit radiation. If we look at X-rays and gamma rays, which are both part of the electromagnetic spectrum, they have similar wavelengths, but they are produced in different ways. So if we have a look at X-rays, and I'm sure you have heard of an X-ray, X-rays are similar to the gamma rays produced in radioactive decay. They are both ionising and are both types of electromagnetic wave, as I mentioned. X-rays and gamma rays both have very high frequencies. In hospitals, X-rays are used by radiographers to produce an image, usually of part of a patient's skeleton, as a photograph. Most X-rays pass through the patient, but the denser material inside the patient, such as bones, absorbs some of the radiation. This causes a variation in the X-rays received by the photographic film, and so an image is produced. So how are X-rays produced? What happens is X-rays are produced by firing high-speed electrons at angled metal targets inside the X-ray machine. The very high voltages are needed to accelerate the electrons to a high enough speed to produce X-rays. When the electrons smash into the plate, the X-rays are emitted. X-rays are much easier to control than gamma rays. To stop an X-ray machine emitting X-rays, all the radiographer has to do is to turn off the electricity. It's not possible to stop a nucleus emitting gamma rays. Unlike gamma rays, the wavelength of X-rays used in hospitals can be varied slightly. Changing the voltage used to accelerate the electrons alters the wavelength of the X-rays. A higher voltage will produce smaller, more penetrating X-rays. Now, if I just stop there and talk about the comparison to ultrasound, if you remember, ultrasound is a high frequency sound wave that is passed through the body, and it bounces off the soft tissue, and however far it bounces back helps to produce an image, whereas X-rays are looking at bones. They are not very good at looking at soft tissue. Another thing about X-rays is they can cause mutations in DNA, which obviously you don't want to do to a developing fetus, whereas ultrasound don't. So if we have a look at gamma rays, then gamma rays are a very important tool for doctors. However, the atoms emitting the gamma radiation are decaying all the time, so most hospitals have to produce their own radioisotopes. A radioisotope is a radioactive version of a normally stable element. Scientists use something called a linear accelerator to smash neutrons into the nuclei, which are normally stable. The neutrons are absorbed, changing the nucleus, the mass number increases, and this can form a radioisotope. The normally stable element has too many neutrons in its nucleus and so may emit gamma rays. We've already learnt that gamma rays are very high frequency, short wavelength electromagnetic waves. They are emitted from the nucleus of some radioactive atoms. Gamma rays have a lot of energy, and as they are a type of ionising radiation, they can damage or even kill cells. Gamma rays are used to kill microorganisms on medical equipment. This process is called sterilisation and is very useful because it makes the equipment safe to use and reduces the risk of infection after an operation. The problem is gamma rays can kill human cells too. Exposure to too many gamma rays can lead to cancer or even death. Despite the dangers, there are some important medical uses. To ensure safety, sources of gamma radiation must be handled very carefully. One of the main uses of gamma rays is in the treatment of cancer. Machines such as the gamma knife fire gamma rays into the body to kill cancerous cells. However, it's really complex because the problem is you're killing the good cells as well that are around it, the healthy cells. If we talk about tracers, radioactive medical tracers are often used to help diagnose problems without the need for an operation. A special sample is produced which contains radioactive atoms, and this is then either eaten or injected into the patient. The image of the patient's internal organs can then be produced. The radioactive source selected must emit gamma radiation, occasionally beta, as alpha radiation is not penetrating enough to leave the body, and also because it's so ionising, it's actually very dangerous if alpha gets inside the body. The source used must also have a very short half-life of a few hours, which means it doesn't stay radioactive for long, because obviously we don't want to cause any more risk to the patient or their families, because the point is we want to actually trace what's going on around the body. Okay, so make sure you know the difference between X-rays, gamma rays and ultrasound.